What are the key considerations when assessing a patient preoperatively, and how do these impact the surgical process? Answer: preoperative patient assessment is crucial to ensure the safety and success of a surgical procedure. The key components of this assessment include physical exam. The veterinary technician should conduct a thorough physical exam to assess the general health of the patient, focusing on vital systems such as the cardiovascular, respiratory, and renal systems. Normal findings such as heart murmurs, respiratory distress, or signs of dehydration can affect anesthetic protocols and surgical planning. History. A detailed medical history, including any prior surgeries, illnesses, or chronic conditions, is important. This allows the technician to identify risk factors for anesthesia such as allergies or adverse reactions to certain drugs. Laboratory tests. Common tests include blood work, CBC, chemistry panel to evaluate liver and kidney function, electrolytes, and clotting ability. These tests can indicate underlying conditions like anemia, infection, or organ dysfunction, which may require adjustment in anesthesia protocols or medication. This comprehensive assessment is critical to tailor the anesthetic and surgical approach, ensuring the patient's safety and optimizing recovery. Explain the principles of suture techniques, and how does the choice of technique impact wound healing? Answer: suture techniques are vital for proper wound closure and healing. The main types of suturing techniques are simple interrupted sutures. This is the most common technique, involving placing individual stitches with knots at each end. It is useful for creating a secure seal in areas with minimal tension. If one stitch fails, it doesn't affect the others, making it a versatile choice. Continuous sutures. A running suture that stitches the wound in a continuous line. This technique is faster than interrupted sutures and is often used in areas under low tension. However, if one part of the suture line fails, the entire line could unravel, so careful tension and knot placement are necessary. Intracuticular sutures. Placed just under the skin, these sutures are used for cosmetic purposes, particularly in areas where scarring must be minimized. They help to reduce visible scarring as the suture is hidden beneath the skin. The choice of technique affects the healing process by controlling tension on the wound, the risk of infection, and the appearance of the scar. Proper technique is essential to minimize the risk of dehiscence, wound opening, infection, and delayed healing. Mr. Davis is preparing a patient for a major soft tissue surgery. The patient has a history of heart disease. What precautions should Mr. Davis take when selecting anesthetic agents and monitoring during the procedure? Answer: given that the patient has a history of heart disease, Mr. Davis must take extra precautions to minimize stress on the cardiovascular system during anesthesia. Here are the key steps to follow. Anesthetic agents. The selection of anesthetic agents should prioritize those with minimal cardiovascular side effects. Inhalant agents like isoflurane are commonly used for general anesthesia because they allow for easy control of anesthetic depth. However, it's important to avoid agents that can cause significant cardiovascular depression, such as halothane. Injectable agents like propofol should be used cautiously, as they can cause transient hypotension. Local anesthetics, e.g., lidocaine or bupivacaine, should be incorporated as part of multimodal analgesia to reduce the need for systemic drugs. Pre-anesthetic sedatives. Sedatives like acetpromazine may be avoided because they can exacerbate hypotension. Instead, a mild sedative like diazepam or a combination of benzodiazepines and opioids might be preferable to reduce anxiety without compromising heart function. Monitoring. Vital signs such as heart rate, blood pressure, and ECG should be monitored continuously. Blood pressure can be particularly affected by anesthesia, so Mr. Davis should have fluids available to support blood volume and maintain hemodynamic stability. The use of a capnograph and pulse oximeter will help track the patient's respiratory and oxygenation status, ensuring they remain stable throughout the surgery. These precautions are important to reduce the risk of cardiac complications during the surgical procedure. Describe the role of analgesics in managing pain during postoperative recovery. What are the advantages of multimodal analgesia? Answer: pain management is crucial in postoperative care to ensure comfort and promote healing. Analgesics commonly used include opioid analgesics, e.g., morphine, fentanyl. Opioids are potent pain relievers used to manage moderate to severe pain, often in the first 24 hours after surgery. They act on the central nervous system to block pain signals, but can cause side effects such as sedation, nausea, and respiratory depression. NSAIDs, e.g., carprofen, meloxicam. These drugs are effective for managing mild to moderate pain and are particularly useful for reducing inflammation. They work by inhibiting cyclooxygenase enzymes involved in the production of prostaglandins, which are mediators of pain and inflammation. Local anesthetics, e.g., lidocaine, bupivacaine. Local anesthetics can be used for regional blocks to provide targeted pain relief in specific areas, reducing the need for systemic drugs. Multimodal analgesia is the practice of combining different classes of analgesics with distinct mechanisms of action to provide enhanced pain relief while minimizing the use of each drug individually. How does the process of sterilization of surgical instruments impact the risk of infection during surgery, and what are the essential steps in ensuring proper sterilization? Answer: sterilization is critical to reducing the risk of surgical site infections, which can result in complications, prolonged recovery, and potentially life-threatening outcomes. The key steps in ensuring proper sterilization are cleaning. Before sterilization, all instruments should be thoroughly cleaned to remove debris, organic matter, and contaminants. This step is essential because debris can protect microorganisms from the sterilization process, reducing its effectiveness. Disinfection. Instruments should then be disinfected using appropriate agents to kill any remaining bacteria and viruses. This step is especially important for instruments that are not being sterilized immediately after use. Sterilization. The most common methods of sterilization are autoclaving, a high-pressure steam sterilization method that is highly effective against bacteria, viruses, and fungi. The instruments are exposed to steam at high temperatures, typically 120 UNDIC, for a specified duration. Gas sterilization. For heat-sensitive instruments, gas sterilization using agents like ethylene oxide can be used. Dry heat sterilization, used for items that may be damaged by moisture, though it is less common than autoclaving. Proper sterilization is essential to ensure that surgical instruments are free from pathogens, reducing the risk of postoperative infection. Regular monitoring of autoclave performance and maintenance schedules is essential to maintain effectiveness. What factors should be considered when determining the depth of anesthesia during the surgical procedure? Answer: the depth of anesthesia during surgery must be carefully monitored and adjusted to ensure the patient is comfortable and secure without experiencing awareness or complications. Key factors influencing the depth of anesthesia include vital signs. The heart rate, respiratory rate, and blood pressure are indicators of anesthetic depth. A decrease in heart rate or blood pressure may indicate excessive anesthesia, whereas elevated vital signs can indicate inadequate anesthesia. Reflexes. Reflex responses, such as the pedal reflex, withdrawal of the leg when stimulated, should be monitored. A lack of response indicates an appropriate depth of anesthesia. Oxygenation. The pulse oximeter should be used to measure oxygen saturation, ensuring that the patient is adequately oxygenated throughout the procedure. Carbon dioxide monitoring. The capnograph measures the amount of CO in the exhaled breath, providing information about ventilation and the adequacy of anesthesia. Inadequate anesthesia can lead to changes in ventilation, resulting in abnormal CO levels. These parameters help guide anesthetic adjustments to ensure the patient remains safely anesthetized without experiencing adverse effects. Mrs. Simmons has brought her dog in for surgery, and the dog is overweight and has high blood pressure. What specific considerations should be made when planning the anesthetic protocol for this patient? Answer: in this scenario, the following considerations should be made. Anesthetic drugs. Overweight patients are at higher risk for complications related to anesthesia because of altered drug metabolism and distribution. The anesthetic protocol should be tailored to the dog's weight and condition. Inhalant anesthetics like isoflurane may be preferred for their digestibility and faster recovery times. The dose of anesthetics should be based on lean body mass rather than total body weight to avoid overdosing. Blood pressure management. High blood pressure can complicate anesthesia by increasing the risk of cardiovascular events. Mr. Simmons should closely monitor blood pressure throughout the procedure. Antihypertensive medications may be necessary preoperatively to stabilize the dog's condition. Preoperative fasting. Overweight dogs are more susceptible to respiratory complications during anesthesia, so proper fasting guidelines, usually 12 hours, should be followed to minimize the risk of aspiration. Fluid therapy. Fluid therapy should be closely monitored to ensure the patient remains adequately hydrated without overloading the cardiovascular system, especially considering the high blood pressure. Discuss the importance of using appropriate monitoring equipment during anesthesia, and how does each piece of equipment contribute to patient safety? Answer: the use of monitoring equipment is essential for ensuring the patient's safety during anesthesia. Key pieces of equipment include pulse oximeter, measures the oxygen saturation of the blood, providing early detection of hypoxia, which can occur if the patient is not receiving enough oxygen during anesthesia. ECG electrocardiograph monitors the heart's electrical activity, detecting arrhythmias or changes in heart rate that could indicate an issue with the patient's cardiovascular function. Capnograph measures the levels of CO in the exhaled air, providing insights into ventilation efficiency and the patient's respiratory status. It can detect hyperventilation or changes in respiratory patterns during surgery. Non-invasive blood pressure monitor tracks blood pressure, which can drop during anesthesia, especially with certain agents. Maintaining normal blood pressure is crucial for ensuring adequate perfusion of vital organs, especially the kidneys and brain. Each of these tools provides essential real-time data, allowing the veterinary technician to adjust the anesthetic protocol and respond promptly to any changes in the patient's condition. What are the potential complications associated with improper pain management postoperatively, and how can they be prevented? Answer: improper pain management can lead to several complications, including chronic pain. If postoperative pain is not adequately managed, the patient may develop chronic pain, which can affect their recovery and overall well-being. Delayed healing. Untreated pain can cause stress and increase cortisol levels, which may impair the body's ability to heal. Pain can also lead to reduced mobility, affecting the recovery process. Increased risk of complications. Inadequately managed pain can cause the patient to become agitated or uncooperative, increasing the risk of dehiscence, wound opening, or self-trauma. Prevention. Multimodal analgesia, combining different analgesic classes, NSAIDs, opioids, and local anesthetics, can provide more effective pain relief and reduce reliance on any single drug. Regional blocks. Using local anesthetics for regional nerve blocks can provide targeted pain relief. Continuous monitoring. Ongoing assessment of the patient's pain level and adjusting medication as needed is essential for preventing complications. What are the major risks associated with inhalant anesthetic agents, and how can veterinary technicians mitigate these risks during surgery? Answer: inhalant anesthetics like isoflurane and sevoflurane are widely used due to their predictability, but they pose several risks. Cardiovascular depression. Inhalants can cause vasodilation and decreased blood pressure, leading to hypotension. To mitigate this risk, the technician should use appropriate fluid therapy and adjust anesthetic depth to maintain stable blood pressure. Respiratory depression. Inhalants can depress respiratory function, potentially leading to hypoventilation or apnea. Continuous monitoring with a pulse oximeter and capnograph ensures early detection of respiratory complications. Malignant hypothermia. Although rare, this condition can be triggered by inhalants in genetically predisposed animals, leading to rapid increase in body temperature and muscle rigidity. If suspected, immediate discontinuation of the anesthetic and administration of dantrolene are required. By continuously monitoring the patient's vital signs, adjusting anesthetic depth, and providing supplemental oxygen and fluid support, the risks associated with inhalant anesthetics can be minimized. Explain the structure of a tooth and its role in dental health, including the significance of the enamel, dentin, pulp, and cementum layers. Answer: a tooth is composed of four main layers. Enamel. The outermost layer, the hardest substance in the body, provides a protective covering for the tooth. It is primarily composed of hydroxyapatite, a form of calcium phosphate. Enamel's main function is to resist wear and tear from chewing, but it is not regenerative, so once damaged it cannot repair itself. Dentin. Underneath the enamel, dentin is a less mineralized tissue that forms the bulk of the tooth structure. It is softer than enamel and is sensitive because it contains nerve endings. Dentin can regenerate to a limited extent in response to damage. Pulp. The pulp is the innermost part of the tooth, containing nerves and blood vessels. It plays a crucial role in tooth health, providing nutrients and sensation. In cases of tooth infection, such as abscesses or pulpitis, the pulp can become inflamed, leading to intense pain. Cementum. This is a bone-like tissue that covers the root of the tooth. It serves to anchor the tooth in the jawbone via the periodontal ligament. Cementum is vital for the stability of the tooth, and in cases of periodontal disease it may be affected by inflammation. Mr. Johnson is a dog owner who has noticed that his pet, Rex, is having difficulty chewing and has bad breath. After veterinary examination, it was determined that Rex is suffering from periodontal disease. What steps should the veterinary technician take to address Rex's condition, and what are the potential risks if left untreated? Answer: in this scenario, Rex is likely suffering from periodontal disease, a common dental pathology in dogs that affects the gums and surrounding structures. The following steps should be taken. Preoperative care. A thorough oral examination to assess the severity of periodontal disease. The technician should check for signs of gingivitis, tartar buildup, and pockets between the teeth and gums. Dental radiographs should be taken to assess the extent of bone loss and any tooth root damage. Procedure. Scaling and polishing. The technician should remove tartar and plaque above and below the gum line using specialized tools such as ultrasonic scalers. Polishing should follow to smooth the enamel surface, reducing the chance of future plaque buildup. Extractions or root canal procedures. In severe cases of periodontal disease, extraction of infected teeth or performing a root canal may be necessary. The veterinary technician must ensure proper sterile techniques during these procedures. Postoperative care. Provide recs with post-surgery pain management and antibiotics if infection is present. Follow-up dental care and a home oral hygiene advice for Mr. Johnson, including brushing Rex's teeth regularly and using dental chews or water additives. If left untreated, periodontal disease can lead to tooth loss, bone damage, and potentially more severe systemic conditions such as heart disease or kidney disease, as bacteria from the mouth can enter the bloodstream and affect other organs. What are the indications for dental radiographs, and how do they aid in diagnosing dental conditions in animals? Answer: dental radiographs, X-rays, are essential tools for diagnosing dental conditions that cannot be detected through physical examination alone. Indications for dental radiographs include assessing tooth roots. X-rays help visualize the roots and bones surrounding the tooth, crucial for diagnosing abscesses, fractures, or deep periodontal disease, detecting abscesses or cysts. Radiographs can reveal infection or cyst formation within the bone or around the roots of the teeth, evaluating fractures. In cases of trauma, radiographs help identify fractures within the tooth or the jaw, determining the extent of periodontal disease. X-rays help assess the amount of bone loss around teeth, which is not visible during a standard oral exam. Dental radiographs allow for more accurate diagnosis and treatment planning, especially when deciding whether the tooth needs to be extracted or preserved. This is particularly critical in species like cats, where dental issues such as resorptive lesions are common but difficult to diagnose without radiographs. What are the primary laboratory techniques used for blood sample collection, and how does the method of collection influence the results? Answer: blood sample collection is a fundamental part of veterinary diagnostics. The primary techniques for blood collection include venipuncture, performed by inserting a needle into a vein, usually in the jugular, cephalic, or saphenous veins. This method is commonly used for obtaining large quantities of blood or in cases where precise sample analysis is needed, e.g. CBC, chemistry panels, capillary collection. This technique involves pricking the skin, typically the ear or paw pad, to collect a small amount of blood for rapid tests or glucose monitoring, while less invasive. This method can sometimes provide less accurate results for certain tests. Cystocentesis urine collection. A sterile needle is inserted into the bladder through the abdominal wall to obtain a urine sample. This technique ensures a clean sample free from contamination. The method of blood collection can affect the sample's quality and the accuracy of the results. For example, using an improper technique or collecting the blood too quickly can lead to hemolysis, destruction of red blood cells, which can skew test results. Furthermore, sample handling post-collection, such as storage temperature or timing of analysis, also influences the accuracy of lab results. Explain the importance of chemistry panel analysis and how the results can assist in diagnosing liver or kidney diseases in animals. Answer: a chemistry panel is a critical diagnostic tool used to assess the functioning of vital organs, including the liver and kidneys. The most relevant parameters for liver and kidney function are liver enzymes ALT. Elevated levels of ALT, alanine aminotransferase, typically indicate liver cell damage. AST, aspartate aminotransferase, can also suggest liver damage, though it can be elevated due to muscle injury as well. ALP, alkaline phosphatase, increases with cholestasis, impaired bile flow, or liver dysfunction. Kidney function markers, BUN, creatinine. BUN, blood urea nitrogen levels rise when kidney function is compromised, as the kidneys are responsible for filtering waste products like urea. Creatinine is another waste product that is filtered by the kidneys. Increased levels can indicate renal insufficiency or renal failure. Together, the results of these tests can provide valuable insights into the presence of liver or kidney diseases such as hepatitis, cirrhosis, nephritis, or chronic renal failure. How should a veterinary technician handle and maintain a microscope for accurate laboratory results? Answer: proper handling and maintenance of a microscope are essential to ensuring clear and accurate laboratory results. Steps to properly handle and maintain the microscope include cleaning, use lens paper and cleaning solutions specifically designed for optics to clean the lenses. Do not use tissues or cloths that may scratch the lenses. Handling: always carry the microscope by its arm and base, not by the eyepiece or stage, to avoid misalignment or damage to the internal components. Storage: when not in use, cover the microscope with a dust cover to protect it from environmental factors. Store it in a dry, stable environment to prevent rusting or degradation of internal components. Calibration: regularly calibrate the microscope, especially when using high-power objectives, to ensure precise magnification. Preventing overuse. Avoid leaving the microscope on for extended periods to prevent overeating. Maintaining a microscope properly ensures clear visual results during tasks like analyzing blood smears, urinalysis, or tissue samples, which are critical in veterinary diagnostics. What is the significance of using a centrifuge in laboratory settings, and how does RPM setting affect the results? Answer. A centrifuge is a laboratory device used to separate components of a liquid sample based on their density. In veterinary diagnostics, it is commonly used for separating serum or plasma from blood cells, concentrating fecal parasites or debris in fecal samples. The RPM revolutions per minute setting is crucial because it directly influences the centrifugal force applied to the sample. A higher RPM generates more force, leading to more effective separation of components. However, if the RPM is too high, it could damage delicate components, e.g., blood cells or plasma, skewing the results. A lower RPM might not separate the components efficiently, leading to inaccurate or unreliable findings. Therefore, understanding the appropriate RPM for different types of samples is critical to obtaining reliable lab results. What are the common methods for collecting and analyzing urine in veterinary practice, and what do the results reveal about an animal's health? Answer. Common methods for urine collection include free catch. This non-invasive technique involves collecting urine directly from the animal as it urinates. While convenient, it may introduce contamination from the animal's external genitalia, making it less ideal for sterile analysis. Catheterization. A sterile catheter is inserted into the bladder to collect urine. This method is more reliable than free catch and is used when a sterile sample is required. Cystocentesis. This technique involves inserting a needle into the bladder through the abdominal wall, obtaining a clean, sterile sample. It is considered the gold standard for collecting urine samples. Urinalysis can reveal several health indicators. Specific gravity measures kidney function. Low specific gravity indicates possible renal failure or dilute urine, while high specific gravity could suggest dehydration. pH level can indicate metabolic or kidney disease. Presence of glucose or protein can signal diabetes mellitus or kidney disease. How does fecal flotation help diagnose parasitic infections in animals, and what are the limitations of this method? Answer. Fecal flotation is a diagnostic technique used to detect parasite eggs in animal stool samples. The sample is mixed with a flotation solution that has a higher specific gravity than the eggs of most common parasites. The eggs float to the surface where they can be collected and examined under a microscope. This technique is useful for diagnosing parasitic infections such as roundworms, hookworms, whipworms, and Giardia. However, the method has limitations. It may fail to detect adult parasites or larval stages. Some parasite eggs do not float well in certain flotation solutions, so selecting the proper solution is critical. The method is not effective for detecting tapeworms or protozoan infections, as these organisms do not produce eggs that float efficiently. In practice, fecal flotation is a vital tool for diagnosing common intestinal parasites in veterinary patients, but it should be used in conjunction with other diagnostic methods for comprehensive results. What is the role of a veterinary technician in anesthesia, and what precautions must be taken when handling anesthetized animals? Answer. A veterinary technician plays a key role in administering and monitoring anesthesia in animals. Their responsibilities include pre-anesthetic assessment, ensure that the animal's health status, e.g., age, medical history, weight, and existing conditions is reviewed before anesthesia to identify any risks. Preparation of anesthetic drugs. Prepare the appropriate anesthetic drugs, including induction agents, e.g., propofol, ketamine, and maintenance agents, e.g., isoflurane, sevoflurane, ensuring proper dosage. Monitoring during anesthesia. Constantly monitor vital signs such as heart rate, respiratory rate, blood pressure, and temperature. The technician uses equipment like pulse oximeters, capnographs, and CGS to track the animal's response to anesthesia, post-anesthesia recovery. Once the procedure is complete, the veterinary technician helps the animal recover from anesthesia by monitoring for signs of complications, e.g., hypothermia, respiratory depression, and ensuring a smooth transition from unconsciousness to alertness. Precautions. Prevention of overdose. Careful calculation of drug dosages based on the animal's weight and condition to avoid overdose. Airway management. Ensure the animal's airway remains clear, especially under general anesthesia, to avoid aspiration or suffocation. Monitoring depth of anesthesia, adjusting the level of anesthesia as needed to prevent the animal from waking prematurely or experiencing inadequate sedation during the procedure. Explain the process of autoclaving and its importance in infection control. Answer. Autoclaving is a sterilization method that uses high-pressure steam to destroy microorganisms, ensuring that instruments used in veterinary care are free from bacteria, viruses, and other pathogens. The standard temperature settings for autoclaving are 120 UNDEC, 250 IDEC for a minimum of 1520 minutes at a pressure of 1520 psi. This process is crucial for infection control because it guarantees that surgical instruments, tools, and other medical devices are sterile and free from infectious agents that could potentially cause postoperative infections. The importance of autoclaving is underscored by regulations such as the Centers for Disease Control and Prevention (CDC) guidelines and World Health Organization (WHO) infection control practices, which recommend steam sterilization as the most effective method for eliminating pathogens. Autoclaving is essential in preventing cross-contamination and maintaining a sterile environment, especially in surgical procedures. What is the significance of proper waste disposal, including sharps in a veterinary practice? Answer: proper waste disposal, especially of sharps and hazardous materials, is critical for preventing injury, infection, and environmental contamination. Sharps, such as needles, scalpels, and glass vials, are particularly dangerous because they can cause puncture wounds leading to potential exposure to blood-borne pathogens like HIV, hepatitis B, and hepatitis C. Regulations like the Occupational Safety and Health Administration (OSHA) blood-borne pathogens standard require that all sharps be disposed of in puncture-resistant, leak-proof containers to reduce the risk of accidental injury. Furthermore, hazardous materials such as chemotherapy drugs or chemical disinfectants must be disposed of according to Environmental Protection Agency (EPA) guidelines to minimize environmental impact. Veterinary practices must implement waste segregation and ensure that hazardous waste is disposed of in compliance with local, state, and federal regulations. Proper disposal protects the health and safety of staff, clients, and the environment. Dr. Stevens notices that several animals in his clinic have developed similar symptoms of a contagious illness. What should Dr. Stevens do to manage the outbreak effectively and prevent further transmission? Answer: in this scenario, Dr. Stevens should follow established biosecurity practices to manage the outbreak. The steps include isolation and quarantine. Dr. Stevens should immediately isolate the affected animals in quarantine rooms separate from healthy animals. This will help prevent the spread of the disease. Any new animals or animals with symptoms should be kept in a separate area. Infection control. Implement strict infection control protocols, including the use of personal protective equipment (PPE), such as gloves, masks, and gowns. Disinfect all surfaces in contact with affected animals, using an appropriate disinfectant known to kill the pathogens in question. Client education. Communicate with clients to explain the situation and advise them on preventing the spread of the disease at home, such as limiting contact with other animals. Reporting. If the disease is zoonotic, Dr. Stevens must report the outbreak to public health authorities following the Centers for Disease Control and Prevention (CDC) and World Health Organization (WHO) guidelines for reporting zoonotic diseases. Monitoring and follow-up. Continue to monitor the animals for any changes in symptoms and ensure that all animals are receiving appropriate treatment. How does the proper use of disinfectants contribute to infection control in a veterinary clinic? Answer: disinfectants play a crucial role in preventing the transmission of infectious agents in veterinary clinics. Surfaces and instruments that come into contact with animals or animal body fluids can harbor bacteria, viruses, and fungi. Using the correct disinfectants helps to reduce or eliminate these pathogens. Key points to consider in the proper use of disinfectants include broad-spectrum efficacy. The disinfectant must be effective against a wide range of pathogens, including bacteria, viruses, e.g. parvovirus, rabies virus, fungi, and protozoa. Contact time. The disinfectant must be left on surfaces for the recommended contact time to ensure efficacy. If the product requires 10 minutes to work, it must be left undisturbed for that duration to kill the targeted organisms. Proper concentration. Disinfectants must be diluted according to manufacturer instructions to avoid under or over concentration, which can lead to ineffective disinfection or damage to surfaces. Compatibility with surfaces. Different disinfectants are suitable for different surfaces, and care must be taken to use the correct product to prevent damage, particularly with sensitive materials like plastics or certain metals. Explain the role of vaccination in controlling zoonotic diseases in veterinary practices. Answer: vaccination is one of the most effective preventive measures in controlling zoonotic diseases, as it helps to prevent the transmission of pathogens from animals to humans. Zoonotic diseases such as rabies, brucellosis, and leptospirosis can pose significant public health risks. Vaccinating animals against these diseases reduces the likelihood of outbreaks that could affect both animal and human populations. Key roles of vaccination in controlling zoonoses include protecting animal health. Vaccinated animals are less likely to contract zoonotic diseases, which in turn reduces the risk of transmission to humans. Preventing cross-species transmission. Vaccinating pets, livestock, and wildlife reduces the potential for cross-species transmission, especially in areas where humans and animals interact frequently. Herd immunity. Vaccinating a large percentage of an animal population creates herd immunity, which can limit the spread of diseases in communities and prevent outbreaks, reducing the need for post-exposure prophylaxis. Vaccination programs can help reduce the need for costly and time-consuming treatments, such as post-exposure rabies vaccination for humans, by preventing exposure in the first place. What are the critical legal and ethical considerations in the management of medical records for veterinary patients? Answer: the management of medical records for veterinary patients involves several key legal and ethical considerations, including confidentiality. Medical records must be kept confidential and protected from unauthorized access. This includes ensuring that records are stored securely either in paper form, locked storage, or electronically, password-protected HR systems. Confidentiality is critical to maintaining client trust and complying with regulations such as the Health Insurance Portability and Accountability Act (HIPAA). Accuracy and completeness. It is essential to ensure that medical records are accurate and complete. This includes documenting all clinical observations, treatments, medications, and procedures performed on the patient. Inaccurate or incomplete records can lead to liability issues and may violate ethical standards set by organizations like the American Animal Hospital Association (AHA). Legal compliance. Veterinary medical records must comply with state-specific regulations, as some states may have laws requiring the retention of records for a specific period, e.g., 3-5 years. Failure to comply with these retention requirements could lead to legal ramifications. Client consent. Clients must give informed consent for their animals' treatment, and records should reflect that consent. Veterinary technicians should ensure that clients are fully informed about the procedures, costs, and potential risks involved. Record ownership. Veterinary clinics retain ownership of the medical records but must provide clients access to them upon request. Records should be transferred to another veterinary facility if the client requests a referral. By adhering to these ethical and legal standards, veterinary technicians help ensure patient confidentiality, compliance with regulations, and the quality of care provided. How can veterinary technicians assist clients in understanding complex medical conditions and treatment options for their pets? Answer: veterinary technicians can play a vital role in educating clients about their pet's medical conditions and available treatment options by employing the following strategies. Active listening. Listening attentively to clients' concerns and questions is crucial for understanding their needs and providing relevant information. By addressing concerns in a clear and empathetic manner, veterinary technicians can build trust with the client. Simplifying complex information. Medical terminology can be overwhelming for clients, so veterinary technicians should explain conditions and procedures in layman's terms. For example, instead of saying acute renal failure, they could explain the condition as a sudden problem with the kidneys that prevents them from filtering toxins. Providing written resources. Offering printed materials, such as brochures or websites, helps reinforce verbal explanations and allows clients to review information at their own pace. Written resources should be easy to understand and visually appealing. Discussing treatment options and costs. Veterinary technicians should clearly explain the pros and cons of each treatment option and discuss associated costs. They should also provide guidance on financial assistance or payment plans if needed. What is the importance of personnel protective equipment (PPE) in preventing the spread of zoonotic diseases? Answer: PPE is essential in protecting veterinary staff from exposure to zoonotic diseases that can be transmitted through direct contact with animals, their body fluids, or contaminated surfaces. PPE includes gloves, gowns, masks, face shields, and boots. The importance of PPE is as follows: barrier protection. PPE acts as a physical barrier, preventing pathogens from coming into contact with the skin, eyes, mouth, or mucous membranes, preventing cross-contamination. PPE helps prevent the spread of infectious agents from one animal to another or from animals to humans. This is particularly important in veterinary clinics where multiple species are treated and zoonotic diseases like brucellosis or tuberculosis are a concern. Compliance with health and safety standards. PPE use is mandated by OSHA standards, which require healthcare facilities to implement protective measures to safeguard workers' health. This includes using the appropriate type of PPE based on the level of risk. By using PP correctly and consistently, veterinary technicians minimize the risk of disease transmission and ensure a safer working environment. Sarah is treating a dog with an unknown viral infection that has caused a sudden decline in its condition. The owner is visibly upset and asking for an update. How should Sarah communicate the situation with the owner? Answer: in this scenario, Sarah should use active listening and empathy to address the owner's concerns. Here's the approach she should take. Acknowledge the owner's emotions. Begin by acknowledging the owner's distress. For example, I can see how concerned you are, and I understand that this is a difficult time for you. Explain the situation clearly. Sarah should explain the dog's condition in simple terms, avoiding medical jargon. For example, the dog is showing signs of a viral infection, and we are working on diagnosing the specific virus. We're doing everything we can to help. Discuss treatment options. Sarah should explain the steps being taken, including tests, medications, and possible outcomes. She should emphasize that the veterinary team is committed to providing the best care for the animal. Offer support and follow-up. Sarah should reassure the owner that they will be updated regularly and that the clinic is available for questions. Offering emotional support through active listening helps calm the owner and fosters a trusting relationship. How does controlling zoonotic transmission protect both animal and human health? Answer: controlling zoonotic transmission is crucial for protecting both animal and human health because zoonotic diseases can spread rapidly between species, often leading to serious outbreaks. Key methods to control zoonotic transmission include vaccination. Vaccinating animals against diseases like rabies and leptospirosis reduces the chances of transmission to humans. Quarantine and isolation. Isolating infected animals helps prevent the spread of disease to other animals and humans. Veterinary practices must maintain quarantine protocols during outbreaks. Hygiene and disinfection. Thorough cleaning and disinfection of surfaces, cages, and equipment reduce the likelihood of zoonotic pathogens surviving in the environment and spreading between animals and humans. Education. Educating both veterinary staff and clients on hygiene protocols, personal protective equipment, and safe handling practices ensures that risks are minimized. By implementing these control measures, veterinary technicians help mitigate the risks of zoonotic diseases, safeguarding the health of both animals and the people who interact with them.